alaikum, everybody. Good evening, good morning, or good afternoon, wherever you all are joining us from. Very, very warm welcome to all of you for joining us today for the Population Health and Wellbeing series. My name is Dr. Sohaila Chima. I'm the Assistant Dean for the Institute for Population Health and also an Associate Professor of Clinical Population Health Sciences here. So thank you for joining us. We have our esteemed speaker also with us. I'm going to first go ahead and share the screen and go through some housekeeping rules and just give you some information about the series. So as you all know that these are the objectives for the series. We like to discuss contemporary and critical topics which are really relevant to healthcare, medicine, and to population health. We also examine evidence-based practices which are germane to public health and patient care, and then describe opportunities and challenges in this evolving phase of healthcare and population health. Some housekeeping: your cameras and microphones have been turned off. You can use the Q&A feature to type questions and comments. These will be addressed at the end of the session. You can also actually just post your question or comment in the chat. So all the hosts and panelists are able to see that. So please, if you feel more comfortable just writing in the chat, go ahead and just pose your question or comment in that. So as a reminder, this is an accredited activity and it is accredited both by ACCME and DHP here in Qatar. The post-activity evaluation, it will be available in your Cloud CME account by the February the 23rd. You will receive an email notification once the evaluation is available in your Cloud CME account. And your certificates will be available for download once you complete the post-activity evaluation on the Cloud CME portal. So with that, we come to begin the session. The topic today is really, really exciting, very, very relevant to the evolving phase of healthcare that we are seeing and global health. So the topic is artificial intelligence and the future of global health. And we have an esteemed speaker with us. It is really my honor and privilege to be introduced Dr. Albert Lowenfels. He is Emeritus Professor of Surgery, New York Medical College, Valhalla, New York, USA, and also Professor of Family Medicine. He has published over 280 articles in peer-reviewed journals. He's been a reviewer for the Journal of the American Medical Association, JAMA, which you might have heard about, BMJ, which is the British Medical Journal, Nutrition and Cancer, Cancer and Research, Pancreas, Gastroenterology, and many, many more. He's an associate editor of Pancreatology. His publications have been supported by the NIH and by the Smithers Foundation. The focus of his research has been on disease prevention, the relationship between benign and malignant disease, pancreatic disease, cystic fibrosis, infectious disease, and health determinants of disease in Middle Eastern populations. Dr. Albert Lowenfels, a very, very warm welcome to you, and over to you.
Sohaila, thanks so much. We look forward to sharing some information with people from all over the globe. And it's a topic that's assuming increasing importance, especially in the last few months. It's been on headlines, all the newspapers, the news outlets. So I think we'll get started.
Yes.
And so this is the housekeeping at the beginning. I have no relative financial information to disclose. Everything we talk about will be legitimate. We're not talking about unapproved drugs or products. And these are the learning objectives. We're going to define the topic because it is a little confusing, the language. We'll recognize how it's changed over time. We'll examine the different ways it's already benefiting patient care, and we'll then end up talking about some new applications of artificial intelligence for the future. Now, this looks at Medline or PubMed, which is the database for most of the medical publications. And you can see there's been a tremendous growth in the frequency of publications on artificial intelligence. So if we start back at about 1990, there have been very few publications, and here we are in 2021, we're up to 27,000 publications per year. That's a tremendous growth, especially in the last few years. It's a huge topic. And here's the representation in the tree format. It covers so many different areas, but we are just going to be focusing on the part that has to do with medicine, particularly medical diagnosis. And that'll be enough that we can fit in for the remaining 45 minutes. Let's start out with some definitions because it is a little bit confusing. The broad term is any technique that enables computers to mimic human intelligence. Now, a subset is machine learning that uses statistical techniques and sort of black box approach that enables machines to improve as they go along. So it's kind of a feedback loop, and that includes deep learning. And deep learning is the subset that permits the software to train itself to perform tasks. That's a little bit frightening, a little bit scary, because the machines will be getting smarter and smarter and using all kinds of data to help themselves get better and better. So another term is that you sometimes hear of something called generative or artificial intelligence. And this is the term for a system that in response to very short prompts can generate output. For example, you can put in text, you can put in images such as a chest x-ray, you can put in sounds such as you hear from your stethoscope or other media or printed material. So all of these consist of the input goes into a black box, and that's the scary part because the software in there is defined by experts, and we're not always sure as a viewer what's going into the black box. And then you have computer generated output, and then that can get fed back into the input again. So the whole circle goes around and can get smarter and smarter. So it's a recently developed tool, and I'd like to take a time trip backwards to about 1900, and you're walking along and you see this machine coming towards you. And you say, what is that? And somebody says, well, that's a car. So here are the questions that you might ask yourself about this new thing that's coming on, this car. So the first thing is, what is this tool? What is it all about? Then the next question is, should I use this tool? Is it going to be of any help to me? And then the third thing is, when should I use the tool? Do I use it all the time or just on a special long trip? Should I still use my horse? Then the fourth question is, how should I use this tool? And finally, the last question is, what are the side effects of this tool and how should I manage them? So these same 5 foundational questions are what we need to apply to artificial intelligence, because they're all important in the evaluation. Now, here's one of the early pioneers, Alan Turing. He was very important in World War II because he was the one that broke the German code and enabled us to find out exactly what the Germans were doing. But he developed what's called a Turing test with respect to artificial intelligence. So here we have an observer, and he is isolated from a computer, which you can see labeled A, and a human, which is labeled B. And if the observer cannot tell the difference between what the human is saying and what the computer is saying, that is what is known as the Turing test. And many people believe that we've now passed that point and that we can no longer tell the difference between what the computer is telling us and what we can do by ourselves. So we'll talk about the Turing test a little bit further along in the presentation. And here is the first computer programmer, supposedly Ada Lovelace. She was the only legitimate child of Lord Byron, the English poet. He had several illegitimate children, but she was the only one that was legitimate. She had some very strong mathematical abilities. She worked to develop an early computer program, and she is considered to be the world's first computer programmer. So that goes back quite a long ways. Here we're looking at the average global life expectancy from birth for males and females put together. It's from WHO data. And if we go back to about 1960, average global life expectancy was about 52 years. And now, at the present time, it's about 73 years. So we've gained about 20 years of life expectancy globally, everybody, all countries put together. So can artificial intelligence make things better? Can we improve life expectancies? So a group of researchers trained an artificial intelligence program on 85,000 chest x-rays from 2 large clinical trials. And then they followed the patients for a period of 12 years. So it's a follow-up study. It's a strong study type. It's like we would consider a cohort study. And the AI program scored each patient's risk of dying during this period. And 53% of the patients in the high-risk group died compared to 4% in the low-risk group. And that gives a risk ratio of about 13. So the computer did a great job. And the computer input looked at things like the shadows in the breast, looked at the lungs, the ribs, the waist, circumference of the waist. It also looked at the region between the shoulder blades. Now, why was that important? What did they find? Well, it turns out, remember, these are just looking at chest x-rays. When you have a chest x-ray taken, you have to take your arms and put them around the machine. And it turns out that patients that are arthritic or sick or old or not healthy cannot do this quite as well. They cannot grasp the x-ray machine. And the computer picked this up. It's something that humans would never have thought about doing. So it was a smart AI that picked that up. So it just shows some of the power of AI. Let's go back to 1997, and this is when the world became convinced that artificial intelligence was here to stay. This is Garry Kasparov from Russia. He was the world champion at the time, and many people consider him to be the strongest chess player ever. And here's Deep Blue IBM in New York that developed a program that could play chess. And Deep Blue won the chess match. This was a shocking experience, especially to those of us that play chess, which is a pretty hard game at the upper levels. Now, computer-assisted diagnosis, the computers can be very helpful at helping us with medical diagnosis. So here's some of the input. You can get information from the heart with an electronic stethoscope. We used to train students how to tell one murmur from another. The electronic stethoscope can do that now. You can get brain waves for EEG. We'll talk about that a little bit later on. You can get breath sounds from the lungs. You can get images from X-rays or CT scans, get lab tests, and you can get patient chart searching. And that is really remarkable because we have so much data in patients' charts, but it's hard to look it up. But the computer can look for keywords and use that to help make the diagnosis. So most radiology programs use or plan to use artificial intelligence as they go ahead, and it will assist the humans. Now, here are some of the major discoveries in communication. I put together kind of a small focus group, and these were the main discoveries that our group thought was important for communication. I'm going to pause for about 15 seconds, let everybody take a look and see if they see something interesting in this pattern. Okay, let's go ahead. Let's see, here we are. And this is the same data just plotted in a timeline. And you can see that the major events in communication are speeding up. Unfortunately, we have blocked out some of the ones on the right, but you can see that there's been a rapid acceleration in communication technologies, so that whereas the time space between writing and the invention of paper was almost 2,000 years, in the more recent communication technologies, it's only been about 20 years. So things have speeded up very rapidly, and that's really due to artificial intelligence. So if we can see the next slide. Now from here on, we're going to be looking at some of the examples from medicine of the role of artificial intelligence. And here's the first example. Now, Dr. Barzilay was the head of an artificial intelligence program in Boston. And she had several mammograms, and she had MRIs, and she had biopsies for breast lumps. And the tests were considered negative or gave conflicting results. But 2 years after she first started having mammograms, she developed breast cancer. And she thought, we can use artificial intelligence to do a better job. So if we can see the next slide. So she and the people in her laboratory developed a model for identifying women at high risk for developing breast cancer. they fed thousands of mammograms into a computer. And then they followed each patient for 5 years to see if breast cancer developed. Again, it's very similar to the previous follow-up study we saw, a very strong study design. And the computer model was more accurate in breast cancer prediction than the radiologists. And it accurately predicted that from her own mammograms that she was in a high-risk group. And artificial intelligence has shown to be 99% accurate and is 30 times faster in reviewing and translating mammograms. So this kind of a program, including the one that Dr. Barzilay developed, is widely used now. It's just better than radiologists by themselves. So here's a question. Will radiology disappear as a specialty? I don't think so, but I think that artificial intelligence, along with a radiologist, is going to do a spectacular job, much better than radiology will do by itself. Now, here's some WHO data about global health care needs in developing countries. Well, we know that half the world's population has inadequate health care. And in Africa, with 25% of the global burden of disease, it only has 3% of the world's healthcare workers. So it's a tremendous mismatch. And the next thing is that developing countries face a real shortage of healthcare workers, but they have widespread access to cell phones. So we can put the two problems together. So AI plus cell phones can be a tremendous help and here's just a few examples, improving communication between healthcare providers and high-risk patients, such as diabetics, by providing data storage systems. We have data, but unless we can access it and store it, and get at it again, it's useless. And then finally, alerting patients about potential public health disasters. So artificial intelligence can tell us about things like COVID-19 or about malaria that's coming up. And so it's a great advantage for developing countries. So let's talk about OpenAI. And this is the name of a new research and development company. It's been all over the news. And its mission is to ensure that artificial intelligence benefits all of us. And the product that we've all heard about is ChatGPT, which is designed to write intelligent speech. And Microsoft recently invested $10 billion in OpenAI. Now, $10 billion, it's not like pocket change. It's not like something you take out of your pocket and put on the bureau at night. It's a lot of money. So Microsoft thinks this is going to be an extremely important development. So ChatGPT was introduced in November 2022. It spread rapidly, and within 5 days, 1 million people were already using it. It's continued to grow astronomically. And within 3 months, ChatGPT became an author on PubMed. That's just unbelievable. And the final thing is anybody can download this program. Anybody and everybody has been downloading this program from the internet. And I recommend this article I downloaded it. I just couldn't believe it. Here's the first article that I could find in PubMed where ChatGPT is an author. So here we have an artificial intelligence author. And I'm just have listed here the first paragraph of the introductory section. And it says, well, you can read it. You can take your time and read it for a minute or two. This first opening paragraph was written by the Chat GPT. And I think it passes the Turing test. In other words, you could not tell whether this is written by a human or by artificial intelligence. And it turns out that this paragraph, the opening paragraph, was written by Chat GPT. The author goes on and writes the rest of the article herself. But it just is very frightening that we can have a paragraph such as this. You could, if you thought about it, you might be able to say it's written by a machine, but it's very convincing. Now, here's another kind of frightening example. They took a group of reviewers from major journals, and they compared 50 genuine abstracts from major journals with 50 abstracts generated by ChatGPT. The reviewers considered that about a third of the ChatGPT abstracts were real, and about 14% of the genuine abstracts were thought to be written by chatbot. And this was a highly significant difference. So here we have trained reviewers that cannot tell the difference between AI written material and real material. And as a reviewer, this frightens me a lot. And about a year ago, we had a presentation on fraud. And this seems to be a real possibility that it could be introducing more and more fraudulent papers. And if we could see the next slide. And I like this quote: if you let the genie out of the bottle, you can never put the cork back in again. And that seems to be true of artificial intelligence. It's got some good aspects, it's got some bad aspects, but it's not going to go away. It's with us from now on. So is artificial intelligence potentially dangerous? And this is a scene from 2001, A Space Odyssey. It was a wonderful book, marvelous movie, and was a exploration of outer space. They were going to go as far as Jupiter. And Hal was the computer that ran the whole operation. And in that ellipse in the center of the diagram between the two humans, that is a picture of Hal, the computer that ran the whole spaceship. But in the film, Hal turns malignant and killed several of the crew members. And it was only a miracle that one of the crew members was able to guide the ship back towards Earth. So there is a potential danger from artificial intelligence, and we need to be aware of that. Next slide, please. Now, this is Raspberry Pi. I don't know if many of the viewers are familiar with Raspberry Pi. But it's a charitable foundation in the United Kingdom, and its aim is to spread computer literacy and make low-cost computers. This diagram shows Raspberry Pi, a tiny little computer. It's about the size of a credit card. It's smaller than your cell phone. It sells for $4, so it's widely available for developing countries. And you can load it with software to do whatever you want. And we'll talk about, or let's go back. Yeah, we'll talk about Raspberry Pi and traumatic brain injury. Now, traumatic brain injury is widespread throughout the world, and it's not easy to diagnose. It's not easy to diagnose, and the current diagnosis is observer dependent. We use what's called the Glasgow Coma Scale, but for confirmation, you need an MRI or a CT scan. But a group of programmers took the Raspberry Pi, this little tiny computer, and loaded with software and hooked it up to an inexpensive EEG, brainwave machine, to produce 90% accurate results for the prediction of mild or serious brain injury. So this is an example of an inexpensive technique that would have great value for research-rich, resource-poor countries, because brain injury is widespread all over the world, because gravity is all over the world quite the same. Here we're looking at COVID-19 and artificial intelligence. And artificial intelligence can help by analyzing the cough pattern. Apparently the cough pattern is somewhat different for COVID-19. It could look at blood samples. It could look at location. Is the patient in an area where there's lots of COVID-19? It can look at X-ray images, CT images. All of this can put together these various different data types to help us decide whether or not the patient has COVID-19. And so artificial intelligence can help us with predicting the outcome. First of all, it can help make the diagnosis. Is this yes or no COVID-19? It can forecast, looking at a whole country, what's going to happen over the next week, month, or year. It can help with drug discovery. We've already had several new drugs that have come out. It can talk about mortality prediction, and it can tell us about disease prevention, disease severity. So there's a good use for artificial intelligence for COVID-19. Now, artificial intelligence is already doing a great job with diabetes. And diabetes is increasing worldwide. It's now about 8 or 10% on a global basis. There's already an FDA-approved screening device for looking at the retina, because diabetes can give you retinal disease and lead to blindness. It can help with problem solving by looking at similar cases. It's already widely used for self-management tools, for dietary decisions, and for medication reminders, and for identification of high-risk populations by means of genomics and microbiomics. So AI and diabetes is a great combination. Now, I'm not going to say too much about this, but it's an example of where artificial intelligence, deep learning, can help with tuberculosis diagnosis. And in this example of where artificial intelligence was trained on a large set of chest x-rays, it was about 97% accurate in diagnosing tuberculosis. So we have just a couple of summary slides. We have some of there are some threats or some promises and challenges with AI. And the first one is, will AI design itself to become more powerful? And the answer is certainly yes. What we're seeing now is just the very beginning. Will the benefits be distributed equally across the globe? That is a challenge. And to what extent will AI assist health providers? I think it's going to be an enormous assistance. We're all going to benefit from it if we use it carefully. And will it accelerate scientific discoveries? I think so. And to what extent will global health be dependent on AI? It has a tremendous potential for helping global health. We've seen some examples in this presentation. Here's a summary. Every presentation should have a summary so that people that are asleep can wake up and look at it and say, oh, well, that's what it was all about. And it's already tackled a broad range of global health issues, particularly with communicable diseases such as tuberculosis, COVID-19, malaria, many other communicable diseases. And it can help with diagnosis, looking at morbidity or mortality assessment, disease outbreak prevention, health policy planning. But there are really large legal issues. If, for example, you depend on artificial intelligence and you come up with the wrong diagnosis, who's responsible? Is it the programmer? Are you responsible for it? That's a huge problem. And then there are ethical, regulatory, and practical considerations that we all need to think about. That brings us to the end of the presentation, and I'd be happy if there are any questions, we can review them now.
Thank you, Dr. Lowenfels, for that wonderful presentation. So, of course, as you said, I think ChatGPT was probably, the most viral thing that happened in the recent news, not only on websites, but across social media. And the usage is also, it's just grown and grown. I don't foresee it coming down at any point. I think we all have to be ready for it. Any thoughts or comments on that? How do you even think, it can affect education or healthcare education?
I'll just say one thing. ChatGPT has recently passed the US MLE examination, so you could be a doctor if you just use ChatGPT. This, to me, is really a big shocker. Why go to med school if you can just pass the qualifying exams using ChatGPT? So we have some scary things ahead of us.
Yes, I think that there's, like you said in your last slide, when you summarize that we need, to focus on the ethics part, the integrity part, the regulatory, all these things need to come into action. So just some questions coming through, Dr. Lowenfels. Do you think that there is a possibility that artificial intelligence will totally replace healthcare workers or people at any point?
It's good. Just repeat the question. I didn't get the last part of the question.
So the question is whether there's a possibility that AI can totally replace healthcare workers or people?
I don't think so. Short answer is no, but I think they'll work together to be much more effective. All the things that we teach medical students, the facts will be available, but they will need judgment as to how to treat the patient. So I think the combination is going to be powerful. I don't think it's going to completely replace them. I'd be shocked if that happens.
Yes, certainly. I think, but we should use it to our advantage where it can help us. So another question is about, do you think, AI is helping in, reading scans and mammograms. Do you think that AI would be able to predict, like, say, for example, mutations, or if they want to find a new mutation in COVID, would that be something that AI would be capable of doing?
I think where it's going to be helpful, yes, short answer for that is yes. I think that's true because it will be able to scan the medical literature. And right now it takes hours and hours to go through everything that's been published. And artificial intelligence can do that. Anything that's in print, it can pick up and summarize and give us leads for mutation analysis, drug development, things of that sort. That'll greatly speed up the whole progress of science, medical
Sure.
science. Yep.
Thank you for that answer, Dr. Lowenfels. So another question, which is again also an important question, that do you think, or how can AI, do you think, can it help us in the early diagnosis and prevention, of course, they've given examples of brain tumors, liver tumors, congenital heart. Do you think there's a role for early diagnosis and prevention that AI can play?
Well, again, the short answer is yes. I think that artificial intelligence will pick up on small clues, put things together, particularly for rare diseases. Now, physicians, healthcare workers have a really hard time with rare diseases because they don't happen very often. And yet the computer can put together small little, what apparently seem insignificant details and come up with something that we may not have thought about.
Sure. Okay, so we have another question, and they're thanking you for this very informative presentation. And the question is that whether you think it can be applicable to developing countries, taking into consideration that these countries are often trained on data by companies based in developed countries. So what is the role, do you sort of see it evolving in developing countries?
That's a great question because I think what the viewer is referring to is a kind of a north-south divide. We have a lot of data from the northern countries, and it's hard to apply all that information to developing countries. I think artificial intelligence will be able to summarize what available evidence we have from developing countries and put together a picture that will be unique for each environment. And that should help them. And it'll also speed up the knowledge base of health workers in developing countries. They may not have as much opportunity to take postgraduate courses, go to meetings, and artificial intelligence can help with that.
Thank you for that answer, Dr. Lowenfels. Another question, but of course related to a specific, disease or spectrum disorder, autism. So asking, have you, during your, experience or in your research, have you seen if AI can help people with autism, or can it help in improving, their condition?
I'm going to have a question mark about that, only because I have no experience with autism. It seems like an area that could be useful, but I'm going to refer that
Yes.
question back to the audience. Maybe somebody that's out there has some experience, because I just do not.
Sure, sure. Thank you. So there's another question, about asking about, how you analyze patterns and predict, analyzing patterns and predicting outcomes. They are very much algorithm based. So where do efficient algorithms and programming end and AI begin, do you think?
Yeah, I think it's the boundary is very soft, but
Mhm.
you don't exactly know where the one begins and the other ends. I can tell you an experience I had quite a long time ago at a medical convention, and there was this kind of a booth that had a computer in it, and you could put in a couple of patients' symptoms, and the computer would come up with the answer. So I put in about a recent patient that had abdominal pain and went into shock. And that's kind of an emergency. And the computer listed several diagnoses, all of which were correct, and it listed hemorrhagic pancreatitis. And if the patient was a woman, it listed ectopic pregnancy. But the boundary between what I knew and what the computer suggested was kind of flexible. But it was a good way of thinking of things that you might have overlooked in your haste to make the correct diagnosis. Yeah.
Great, thank you very much. So again, I know you've mentioned, and somebody specifically said that AI needs to be used carefully. So again, the question is, how difficult is it to define, carefully in this situation when things are evolving so fast?
Yeah, that's again a very thoughtful question. We're just in the early phases of
Right.
when, how, and we need to work our way through that. And there will be, I think, every hospital, every medical organization is going to have to come up with guidelines,
Mhm.
just as we have guidelines for the diagnosis of disease. We'll have to come up with guidelines how to use artificial intelligence.
Right. Right. So I think these were most of the questions that we had received. Any other thoughts, Dr. Lowenfels, from your end, how you see it evolving, what's going to be happening, what are some of the challenges?
I think this is a area of great growth. I think if I were a young health practitioner, I would want to watch the area very carefully, because you're going to need to work with it. You don't want to work against it. I'm going to leave the that's going to be my final thought on the whole area of artificial intelligence. So thanks a lot, Swahila, and I thank all the viewers. These are intelligent, wonderful questions, and we can all go on and do some more thinking about this.
Yes, absolutely. Thank you again, Dr. Lowenfels, for this wonderful, wonderful talk. And we thank all our viewers also who joined us today. And we look forward to seeing you all again at the next session in March. Thank you, Dr. Lowenfels, and we look forward to seeing everybody else at the next iteration. Bye-bye for now.